start now. Okay, hello, welcome to MedSoc. Today we're going to be talking about... Okay, I'll just cut that bit out of the video then. Okay. Have you good? Okay. So today we're going to be talking about vampires, which are the perceptions or interpretations of disease. So it's not about supernatural, I promise. So, can some of you give me some symptoms or signs of vampires? Go on then.
Craving for blood.
Okay. My handwriting's disgusting.
Fangs.
Okay. Anyone else?
Fangs.
Go on. Sensitive to light. Okay.
Oh yeah. Well,
Anyone else?
Pale skin.
Okay.
oh, you're so
Thanks, man.
Yeah?
Ice cold skin.
Ice cold skin.
That
I'm
makes
just
sense.
gonna write that with the
That's
skin.
not even right.
Okay.
It is in Twilight.
Yeah?
They don't like garlic.
Okay.
That's simple, is it?
Huh?
Station. Thanks.
Fine, okay.
That's fictional. I'm sorry.
That's fictional.
It's okay. Fictional or not fictional. Anyone else? Yeah?
Oh really?
They have no reflection.
No reflection. Okay. I don't know how to explain that, but yeah.
They look like Robert Pattinson.
I'm not gonna write that.
That's a nice symptom.
Yeah?
Based on fictional.
Hair on their palms. Okay.
That's me as well.
I guess it's a male thing.
Is that actually a thing?
Anyone
Palms
else?
is that? Yeah.
Some of them can turn into bats.
Okay.
I think that's what they're trying to say. That's a symptom.
I just like the vampires are. Okay. No one else? Okay. I'm gonna have to rub this one out now. But yeah, so some of these symptoms you can kind of see where this is going. Like some of these symptoms can come up in disease. So what are the origins of? Okay. I need to rub this out somehow.
There's a ball drop above your head.
Yeah.
With my head? Oh. Okay, so the origins of vampires.
My bad.
So stories of vampires or similar creatures have been found in many cultures and time periods going as far back as the ancient Greeks. So this is like a very universal myth. So they're found in Philippine legends, in South America, in Scotland, in Australia. And many of the traits and superstitions we associate with vampires come from actual diseases, which or from the biological process of corpse decomposition. So basically how bodies rot. And I don't know why the board's like that, but it says the widespread prevalence of a mythological creature that feeds on human life force displays the universal nature of disease rather than of culture. Because disease, regardless of the culture, you can have many different variants of the myth, but the disease will always be the same. Disease is universal. So, conditions that can be linked to vampirism can include rabies, porphyria, tuberculosis, pellagra, and catalepsy. Catalepsy isn't really a disease, it's more of a symptom, but I'll put that in there. So they may not be common now, like for example rabies. Rabies was very, very common, or tuberculosis was quite common maybe like 100, 200 years ago. And it also comes from the word, the Bram Stoker's Dracula, which is like when vampires became popularized in the Western culture, comes from the Greek word which means plague carrier. And an example of this can be like rural hamlets and farming villages in Transylvania, which is where Dracula is supposed to be from. Disease struck and people and cattle died, and many would blame an undead spirit. So you can kind of see how disease can cause superstition if the education or like the technology isn't there to find out what it actually is. Yeah.
Is the Dracula the same as the vampire?
Dracula is an example of vampire. It's like a mythological story. Okay, so the first disease we're going to look at is rabies. So rabies is a viral disease caused by rabies lyssavirus and is transmitted through direct contact with saliva or nervous tissue of an infected animal or person. Usually the most common way of rabies transmission are dog bites. So the virus infects the central nervous system and it reaches the brain, causing symptoms of anxiety, confusion, and agitation, insomnia, hallucinations, and abnormal behavior, and eventually does kill you. It's fatal if not treated before clinical signs appear. So once you find out you have rabies, you kind of have a death sentence. But it is preventable by vaccine. That's why the rate of rabies is very, very low now. During the period when tales of vampires were first emerged from Eastern Europe, there was a major epidemic in wolves, dogs, and other wild animals in like the 18th century, which is when like Dracula was set. So symptoms that relate to the symptoms we discussed. Savage and violent beasts can lead to their like erratic behavior. The transmitted via bites or blood-to-blood contact is also how rabies is spread. Can be caught from animals like vampire bats. Also can be caught from animals. Drinking blood when people die of rabies, they can have hemorrhages, which are like blood leaking from blood vessels, and that can, if you have them near your mouth, it can kind of look like you've been drinking blood. And also avoiding garlic, mirror sunlight, and people with rabies are averse to strong stimulus, such as bright light or strong smelling garlic, because it messes up with your nervous system. Another similar disease is porphyria, which is a group of related disorders that are usually inherited. It's to do with the production of enzymes that convert porphyrin, which is like a ring in your hemoglobin, to a heme group. A heme group is like, I don't know if you've done protein structure, but it's like it has iron in it, which binds to oxygen, takes oxygen around the body. The binding of that to porphyrin is where people with porphyria, like, they lack the enzymes, so porphyrin like builds up because there's nothing to break it down. So that causes symptoms that affect the nervous system and skin. So that can include pain in the chest, legs, abdomen, nausea, muscle pain, weakness, paralysis, breathing problems, heart palpitations, so like irregular heartbeat, high blood pressure, and seizures. And treatment involves avoiding triggers and preventing complications. And if attack does occur, you can have hemin injections, which are a type of enzyme that breaks down porphyrin, but your body doesn't actually produce them, so it's only a temporary effect. Common vampire symptoms that relate to porphyria symptoms are hating garlic, and the high sulfur content of garlic can cause porphyric attacks. So that is probably the reason why like lots of people who suffer from porphyria avoid garlic. Fangs, which I think we discussed, can result in facial disfigurement, and gums can recede, causing a fanged appearance, especially with your canines. And drinking blood, you can have red or brown urine, and if it's not to do with drinking, but it looks like from like a medieval peasant's perspective that like someone who's peeing red has been drinking blood. And medieval doctors also recommended drinking animal blood to make up for the enzymes they lack, but it doesn't really make sense now. They don't do that. And avoiding sunlight can affect your skin sensitivity. Because it can cause a sensation of burning because your skin isn't built up as strong as it should be. So like this is an example of like the typical vampire on the left, and then someone who is porphyric, and you can see there's so many similarities, and you can kind of see if you were like a peasant in the 1600s and you came across someone like that, you would think they were a vampire as well. So yeah, that's another example of a disease. Tuberculosis, very, very common disease, caused by Mycobacterium tuberculosis, and it attacks the lungs and destroys its tissues. Symptoms include persistent cough, weight loss, fatigue, night sweats, loss of appetite and fever, and can be prevented by vaccines. And treatment can also include like antibiotic drugs. A case study, well, more example, is Rhode Island, which is in New York. Was considered the vampire capital of America in the 19th century due to high TB rates and superstition. So, an example, it all began with this girl called Mercy Brown since she was 15, and she died of tuberculosis in 1892, and in the weeks after her death, her brother also got tuberculosis, but no one knew it was tuberculosis because it was the 1800s. And her parents' bodies were exhumed, so basically they were dug up and examined to see like what's wrong with them, and people became because so many people of the same family died of the disease, people thought that girl Mercy had spread vampirism to her whole family, and the townspeople suspected a vampire was at work. And when they found her body to be more intact than those relatives, because she died more recently, they decided she was a vampire, removed the heart, burnt it, and fed the ashes to her brother, who was already dying of tuberculosis, and then he died. And Rhode Island, like because of its high TB rates, because it was an island, was called the vampire capital of America. So symptoms that are similar are the life being sucked out, so like muscle wastage and that sort of thing. Tuberculosis can also cause pale skin and weight loss, and it also spreads via direct contact. So that's why the whole family, like a family of vampires thing, came about. And drinking blood, it's more to do with like people with tuberculosis cough up blood, so their handkerchiefs were covered in blood, and that was like raised suspicion. This is like a poster from the time. It says, "Believe in vampires, Rhode Islanders who are sure that they exist." instances told of where the living have been attacked and preyed upon by the representatives of the unseen world. So people genuinely, legit thought it was a thing. Like, it was quite a big scare in the 1800s. Another one is pellagra. It was first recognized in 1735, so around the time that vampires became popularized in Western Western culture, I suppose. And it's caused by a lack of vitamin B3 and its precursor molecules, so like molecules that go turn into vitamin B3. And it was the scourge of Europe and the US for 2 centuries. After American corn was introduced to Europe, food calories yielded per acre increased greatly over what had been provided previously by rye and wheat. So basically, farmers in Europe started to grow crop because it was cheaper and easier to eat than wheat, because wheat required like a lot more diligence when farming. And it became the main food source, and so that did not have enough vitamin B3 compared to wheat and rye, and people started to have pellagra. And the symptoms are identified by the 4Ds: dermatitis, dementia, diarrhea, and then eventually death. And it can be cured by vitamin B3 supplements. Similar symptoms include avoiding sunlight. When you have pellagra, you have dermatitis, which is like really dry, flaky skin, and if you go in the sun, that can cause really bad sensations, like burning sensations. And unpredictable and violent behavior. So the lack of vitamin B3 can cause the neurons to degenerate, leading to dementia, and hence the unpredictable behavior. And the last one, catalepsy, which is more of a symptom than a disease, but it's a dysfunction of the nervous system and a symptom of diseases such as Parkinson's and epilepsy. And no one really knows how, even now, like, no one really knows what causes it. Some people think it's to do with, like, a specific enzyme, but no one really knows, to be sure. And it can cause trance or seizures, which cause a loss of sensation in the musculoskeletal system, the muscles, to become stiff and immovable. So that kind of links to when people die, their muscles become stiff, and people like this, people with catalepsy, their muscles also become stiff, but they're not dead. And a pulse usually can't be detected unless using specialized equipment. And so if you saw someone that was frozen and they didn't have a pulse, you would think that they're dead. But now we have technology to find out they're actually not dead. But they wouldn't have known that at that time. So people sometimes were buried alive when they had catalepsy because they looked like they were dead. And if you were able to recover, you can crawl your way out of the grave, I suppose. And that may have scared a bunch of peasants and thought that, like, you know, vampires come from the undead. And that's like a picture of a woman with catalepsy. She kind of looks a bit dead. Okay, so what can folklore and perception of disease teach us? It teaches us that, like, scientific perception, or the scientific explanations there usually is scientific explanation for supernatural phenomenon. Obviously, not every science can't explain everything, but usually, especially, like, we can prove that some events in history or some tales in folklore actually have some medical basis in them. It's also the importance of listening to the patient as a doctor and taking all their symptoms seriously, even if they are bizarre. Like if someone tells you they just suddenly don't like garlic, or I don't know, their teeth, they have fangs, like that seems a bit weird to a doctor, but you really need to take them into consideration, and like maybe look at other less common diseases. For example, pellagra and catalepsy are not very common nowadays, so it's important to learn about rare diseases. And the ostracization of sufferers. So people with abnormal antisocial symptoms tend to be ostracized and alienated in society even now. So like with people with neurodivergence or special needs, and back then people who had like vampire-like symptoms were ostracized and cast away from society and sometimes burned alive or buried alive. Like it was quite bad for someone who's already suffering so much from a disease to go through all that social rejection as well. So empathy is needed to be able to ensure the best care is available, and the public is more accepting of sufferers. And that links to the next point, which is importance of education on disease to the public to prevent misinformation. Yeah, any questions?